Ultrasound for uterine lesions. First is the pelvic sonoanatomy. If you look at the anatomy, this is fundus of the uterus. The body of the uterus has got its body and fundus, and then is the cervix. Here is vagina. So we can divide the uterus into three parts: cervix, body of uterus, and fundus. These are two ovaries. Then we have the fallopian tubes, endometrium. Here, this is the myometrium, the cervical canal, and vagina. When the patient is lying supine, here is the vagina. Then comes the external os. Here is the internal os. In between the internal os and external os is the cervix, and beyond the internal os is endometrial cavity. This is the body of the uterus, and we have got the fundus of the uterus. Here is rectum, anal canal, urinary bladder, pubic symphysis, and female urethra. While scanning transabdominal, when we put the transducer transversely, the head of the transducer is towards the right hand of the patient. We get cut section of the urinary bladder with body of uterus. This is right ovary and left ovary. This is another view in which you can see the left ovary with the dominant Graafian follicle. This is the right ovary. We have got the cut section of the uterus, and this is urinary bladder. Longitudinal view of the uterus. This is urinary bladder, transabdominal scan. Here is vagina. This is the external os, internal os, cervix, internal os, and then is the body of uterus. Here we can see the vaginal canal.